Hi there, Dr. Zwelling here, and I want to talk to you about chest pain. You know, we all kind of speak about chest pain in a very general sense, and many patients know that it's a ticket to getting into an emergency room. So if you think you've got chest pain and you tell the clerk outside you got chest pain, you'll be whisked in front of many other patients. Well, maybe that's not fair, maybe it's expensive, maybe it's necessary. How do you know? First of all, ask yourself, do you have risk of heart disease or stroke? A 10-year-old having chest pain is completely different than a 60-year-old having chest pain. If you already have heart disease, if you know that for a fact, chest pain certainly would bear a much more important place on your plate and would be of greater concern to you. But there are some signs and symptoms that you should know about. And whether you're a man or a woman, do not discriminate this. Chest pain is chest pain. If you feel a heaviness on your chest, not just a little ping, but a real heaviness on your chest, if you have some shortness of breath, if you have a cold sweat, if that pain radiates into your neck or down your arm, if you feel palpitations, if you feel dizzy, common sense would tell you, there's something really wrong. Do not call your doctor first, call 911. Here's what we do know. Chest pain that's taken care of in a timely fashion saves lives. So if you think you have legitimate chest pain, call 911. Here's another little helpful hint. After you get to the hospital and the doctor tells you everything is fine and they send you home, ask him to draw a very special lab test. This test is not known to many physicians. It is a test that comes out of the Cleveland Clinic. It's called myeloperoxidase. Let me say that again, myeloperoxidase. You may have to take it back to your doctor's office in a tube so that your doctor can send it directly to the Cleveland Clinic for evaluation. This particular lab test is a wonderful means of predicting who's really at risk for heart disease and stroke. So just because you've been to the emergency room and you're told your heart muscle is fine, that doesn't mean that it will be fine in the next 6 months or 6 years. So if you have concern, do not let the emergency room be your final stop. Get a myeloperoxidase level, go back to your physician, discuss that with him, and ask a couple of key questions. And here are the key questions about heart disease. And I invite you, by the way, to look on the Clinical Notebook site for other discussions about heart disease and stroke. But the question with respect to heart disease is not what is my cholesterol. It is, first of all, how many particles do I have? How many cholesterol particles do I have running around in my system? And the most important question, do I have inflammation? Heart attacks and stroke, vascular disease is an inflammatory process. The question is, do I have inflammation? And until your doctor can tell you you have no inflammation, you have not received the proper answer. If you have questions about that, and if your doctor cannot answer that question, I would ask you to go to a couple of websites, the Cleveland Clinic website being an excellent one. Call the Cleveland Clinic. They'll find a doctor in your area that can answer that most important question. This is 2012. We don't need to be answering that question like we live in the 1950s. We're much more sophisticated now. We should be preventing heart attacks and strokes. And again, the key question is, do I have inflammation? So don't let the answer in an emergency room stop you from pursuing that question. And if you have inflammation, if you already know that and your doctor's told you that and you have chest pain, please do take it very seriously and call 911 and make sure that you're safe. Thanks for listening.